Welcome to the official Global RPH YouTube channel. We're so glad you're here. If you haven't already, hit that subscribe button to stay updated with our latest videos. Stay to the end for our frequently asked questions. A staggering 21 million adults in the United States have experienced at least one major depressive episode, highlighting the urgent need to understand the brain-gut axis in mental health. Recent studies involving 2,539 adults have uncovered strong links between the gut microbiota composition and mental health outcomes. Specifically, scientists identified that higher levels of Eggerichella bacteria have been associated with depression, while lower levels of Subdala granulum bacteria are closely connected to depressive symptoms. The gut microbiome plays an important role in mental health due to its complex structure. About 75 to 80% of this ecosystem consists of Bacteroidetes and Firmicutes bacteria. This diverse community produces key substances such as neuropeptides, hormones, and short-chain fatty acids that influence how the brain functions. Additionally, research has demonstrated that transferring microbiota from depressed donors to non-depressed recipients results in depression-like symptoms, establishing a clear causal relationship between gut bacteria and mental health conditions. This comprehensive review examines the following: the fundamental mechanisms of gut-brain communication, the role of specific bacterial populations in mental health, the impact of chronic stress on gut microbiota, evidence-based treatment approaches targeting the gut-brain axis. Understanding the gut-brain connection. The communication between the gut and brain involves a complex network of pathways, creating a two-way system. This complex pathway includes neural, endocrine, and immune mechanisms that work together to maintain gastrointestinal homeostasis and influence cognitive functions. Key components of the gut-brain axis. The gut-brain axis consists of several interconnected systems: the central nervous system, brain and spinal cord; the autonomic nervous system, sympathetic and parasympathetic; the enteric nervous system, gut's neural network; the hypothalamic pituitary adrenal HPA axis; and finally the immune system components. How gut signals reach the brain. The transmission of gut signals to the brain occurs through multiple pathways. Primarily, specialized cells called enteroendocrine cells detect signals from the intestinal environment and communicate with the nervous system. These cells form synapses with vagal neurons, enabling rapid signal transmission that occurs within 60 to 800 milliseconds. The gut microbiota produces neurotransmitters and metabolites that play a key role in brain function. These chemicals travel through the bloodstream or activate neural pathways, allowing for fast communication between the gut and brain. This quick response enables the brain to react to changes in the gut environment, with sugar signals reaching the brain in just milliseconds. Role of the vagus nerve. The vagus nerve serves as the primary communication highway between the gut and brain. Consequently, this cranial nerve contains both afferent fibers, 80% transmitting sensory information, and efferent fibers, 20% controlling gastrointestinal functions. Moreover, vagal afferent fibers are strategically distributed throughout the intestinal wall, though they do not cross the epithelial layer. The vagus nerve's sensory capabilities extend to detecting various gut signals through specialized endings: intraganglionic laminar endings in the myenteric plexus, intramuscular arrays acting as stretch receptors, mucosal endings at villus tips. Research has demonstrated that the vagus nerve responds to multiple gut-derived signals, including bacterial compounds and metabolites. These signals are integrated in the nucleus tractus solitarius and then relayed to various brain regions, affecting mood, cognition, and behavior. Impact of gut bacteria on mental health. Recent studies have found unique microbial patterns in individuals with mental health conditions. Research shows that people with psychiatric disorders, especially depression, exhibit marked alterations in their gut microbiota composition, types of beneficial gut bacteria. The presence of specific beneficial bacteria plays a key role in maintaining mental well-being. According to research, anti-inflammatory bacteria such as Faecalibacterium and Coprococcus consistently correlate with higher quality of life indicators. These beneficial microorganisms contribute to mental health through multiple mechanisms: production of neurotransmitters, serotonin, GABA, dopamine, generation of short-chain fatty acids, maintenance of gut barrier integrity, regulation of immune responses, support of tryptophan metabolism. Harmful bacterial patterns in depression. In relation to depression, research has identified specific bacterial imbalances. Studies show that individuals with depression exhibit an increased Bacteroidetes-Firmicutes ratio, characterized by a higher presence of bacteroids and a decrease in Blautia. Interestingly, the bacteria genera Aneromacillibacillus and Gordonibacter are found at higher levels in individuals with social anxiety disorder. The dysbiosis pattern in depression evidently includes increased levels of pro-inflammatory bacteria. Studies show that bacteria like Oscillobacter, Parabacteroids, Klebsiella, and Desulfovibrio are more abundant in those with depression. These gram-negative bacteria contain lipopolysaccharides that trigger immune responses and inflammation through the release of pro-inflammatory cytokines. Regional variations exist in microbial compositions among patients with depression. For instance, studies from China report increased Agarthella and decreased Coprococcus and Fusicatenibacter. Similarly, investigations have revealed that non-bacterial microbiota, such as specific Cautovirales bacteriophages, show altered patterns in depression. The effects of these microbial changes go beyond just their presence. Studies demonstrate that transferring fecal microbiota from depressed individuals to rodents can induce depressive behaviors, suggesting that microbial imbalances might play a role in the development of depression. Furthermore, gut fungi, particularly Candida albicans, may also affect mental health by disrupting the balance between fungi and bacteria in the gut. Physical and psychological stress can have a profound impact on the gut microbiome, disrupting its balance in ways that influence mental health. Stress signals from the autonomic nervous and circulatory systems reach the gut, particularly through a newly identified pathway involving bone marrow. Recent studies highlight inflammation as a key factor connecting gut dysbiosis to mental health issues. Research shows that inflammation not only acts as a marker for psychiatric conditions, but also plays a role in their development. Meta-analyses have found notable changes in 30 out of 44 inflammation-related factors across various mental health disorders. The intestinal barrier's integrity plays a vital role in preventing systemic inflammation. When compromised, this leaky gut allows bacterial products to enter circulation, triggering inflammatory responses. Key inflammatory markers in the gut include fecal calprotectin, elevated in 70% of Alzheimer's patients, lipopolysaccharide from gram-negative bacteria, pro-inflammatory cytokines like TNF-alpha, interleukin-1 beta, interleukin-6, and tight junction proteins such as zonulin. When the gut sends out inflammatory signals, the brain reacts with distinct immune changes. Microglia, the brain's main immune cells, shift from their normal state to an activated one. As a result of this activation, microglia produce increased levels of pro-inflammatory cytokines and reactive oxygen species, leading to ongoing neuroinflammation. The blood-brain barrier undergoes significant changes during inflammatory conditions. Research demonstrates that pro-inflammatory cytokines alter blood-brain barrier permeability by disrupting tight junction proteins. Therefore, this compromised barrier allows greater penetration of circulating inflammatory molecules into the brain tissue. The inflammatory response creates a complex feedback loop between the gut and brain. Initially, gut imbalances or dysbiosis trigger local inflammation, which then spreads systemically through multiple pathways. In turn, peripheral inflammation impacts both gut and brain function through direct neural communication via the vagus nerve, circulation of inflammatory cytokines, and activation of the hypothalamic-pituitary-adrenal axis. Studies indicate that chronic systemic inflammation precedes individual depressive symptoms. In fact, research shows that elevated C-reactive protein levels before stressful events predict greater depressive symptoms during challenging periods. Nevertheless, the relationship between inflammation and mental health is two-way, with psychological stress worsening inflammation in the body. Modern clinical assessment of the gut-brain axis requires a multifaceted approach, combining both traditional and innovative testing methods. Today's evaluation protocols include gut microbiome analysis alongside psychological assessments to create a clearer diagnostic picture. Clinical evaluation of gut health begins with standard laboratory studies, primarily including complete blood count, electrolytes, and liver biochemistries. In addition to these basic screenings, more specialized tests are used to examine specific aspects of gut-brain interaction. Advanced diagnostic tools include fecal calprotectin for intestinal inflammation assessment, organic acids test for metabolic byproducts, micronutrient testing for 31 essential vitamins and minerals, adrenal cortex stress profile for daily cortisol rhythm, and array 2 testing for intestinal barrier function markers. Quantitative PCR and flow cytometry are reliable methods for accurately measuring microbial load, giving clear insights into bacterial populations. At the same time, next-generation sequencing techniques such as 16S ribosomal RNA amplicon sequencing and shotgun metagenomic sequencing offer a thorough analysis of the relative abundance of bacteria. Mental health assessment protocols mainly focus on identifying the bidirectional relationship between gut dysfunction and psychological symptoms. The Cognition Self-Assessment Rating Scale, or CSARS, presently serves as a validated tool for evaluating various cognitive functions. This 12-item scale assigns scores from 0 to 3, where 0 to 11 indicates mild cognitive problems, 12 to 22 suggests moderately severe cognitive deficits, and 23 to 33 denotes severe cognitive impairment. Clinical trials have documented a strong connection between gut microbiota interventions and mental health outcomes. Research spanning from 2002 to 2016 shows that probiotic supplementation improved anxiety scores in 35 chronic fatigue syndrome patients. Additionally, a 2015 study involving 710 young adults revealed an inverse relationship between fermented food consumption and social anxiety symptoms. To better understand the relationship between gut health and mental health, healthcare providers sometimes use advanced diagnostic tests like the GI map with zonulin and GI effects. These tests help clinicians understand the complex interplay between intestinal permeability and mental health manifestations. The growing interest in psychobiotics, which are probiotics that specifically target mental health as therapeutic agents, has increased the demand for more advanced diagnostic tools. Clinical trials from 2002 to 2016 have demonstrated varying degrees of efficacy, with some studies showing up to 40.7% improvement in general condition after 6 months of probiotic intervention. Treatment approaches using gut health. Scientific evidence supports targeted interventions for the gut-brain axis as a promising approach to mental health treatment. First and foremost, research demonstrates that modifying gut health through specific interventions yields measurable improvements in psychological well-being. Dietary interventions. The Mediterranean diet stands out as a primary dietary intervention, with clinical trials showing substantial improvement in depressive symptoms. This anti-inflammatory eating pattern emphasizes whole foods and plants, soluble and insoluble fiber, antioxidant-rich fruits and vegetables, fermented foods, and limited processed foods and saturated fats. Measuring treatment success. Patient-reported outcomes, or PROs, fundamentally serve as the cornerstone for evaluating treatment success in disorders affecting the gut-brain axis. These structured assessment tools directly measure patient experiences without clinician interpretation. Primarily designed for both diagnostic and therapeutic response evaluation, PROs provide crucial insights into symptom patterns and severity across the treatment journey. Biomarker monitoring. The advancement of sequencing technologies has enabled comprehensive monitoring of treatment outcomes through specific biomarkers. Current research indicates that gut microbiota produces or stimulates the production of key neurotransmitters such as serotonin, dopamine, gamma-aminobutyric acid, GABA, short-chain fatty acids, and inflammatory cytokines. Future research directions. Breakthrough discoveries in gut-brain axis research herald promising therapeutic possibilities and innovative assessment methods. Researchers have uncovered major developments in understanding gut-brain communication, with profound implications for medication development and treatment approaches. Emerging therapeutic targets. Recent investigations have identified several promising therapeutic avenues. scientists have successfully shown that engineered bacteria expressing antidepressants, coupled with fecal microbiota transplantation, show potential in depression treatment. Primarily, these approaches focus on selective serotonin reuptake, inhibitors optimization, gut microbiota manipulation techniques, engineered bacterial therapeutics, dietary intervention protocols, and fecal microbiota transplantation refinement. In light of these developments, researchers have established that antidepressants and emotion-focused medications may require reconceptualization. Correspondingly, studies indicate that understanding serotonin's role in gut-brain communication could revolutionize treatment strategies for anxiety, depression, and irritable bowel syndrome. In the meantime, genome-wide association studies involving 450,000 individuals have revealed extensive genetic overlap between gastrointestinal tract disorders and psychiatric conditions. This shared genetic basis further supports the gut-brain connection and opens new avenues for therapeutic intervention. Future studies will focus on higher-resolution microbiota analysis, methods, functional readouts, and sex-specific effects in longitudinal investigations. The gut microbiome's key role in influencing cognitive networks suggests that imbalances may contribute to various conditions, including PTSD severity, by affecting neural circuits involved in stress regulation. The expanding science linking the brain-gut axis has underscored the benefit of non-pharmacologic therapies in acute pain management. Researchers recommend competency-based education initiatives at the trainee level to break down barriers that often result in provider burnout when treating these patients. Additionally, mechanisms for providing timely feedback to attendings who exhibit stigmatizing attitudes toward patients with gut-brain disorders have been proposed. Recent research into the gut-brain axis is shedding light on how gut health profoundly impacts mental well-being. Studies have uncovered strong links between the gut microbiome and mental health through several key pathways: direct neural communication via the vagus nerve, immune system modulation, production of neurotransmitters and metabolites, and stress response regulation. Research shows that improving gut health can lead to noticeable benefits in mental health. This highlights the importance of a well-rounded treatment plan that includes dietary adjustments, probiotic support, and lifestyle changes. Mental health outcomes improve significantly when healthcare providers assess and address both gut and brain health during treatment planning. Frequently asked questions. Question 1. How does the gut-brain axis affect mental health? The gut-brain axis significantly influences mental health through various mechanisms. The intestines and brain communicate bidirectionally, with gut distress potentially causing or resulting from anxiety, stress, or depression. This connection involves neural pathways, immune system responses, and the production of neurotransmitters and metabolites in the gut that impact brain function. Question 2. What role do gut bacteria play in mental well-being? Gut bacteria play an important role in mental well-being by producing neurotransmitters, regulating immune responses, and maintaining gut barrier integrity. Beneficial bacteria like Faecalibacterium and Coprococcus are associated with better quality of life indicators, while imbalances in bacterial populations have been linked to depression and other mental health conditions. Question 3. How does stress impact the gut microbiome? Stress alters the gut microbiome composition. Acute stress can rapidly change bacterial levels, while chronic stress leads to more persistent alterations. These changes include decreased abundance of beneficial bacteria and increased levels of potentially harmful bacteria. Stress-induced alterations in the gut microbiome can persist for extended periods, affecting overall health and mental well-being. Question 4. What are some effective treatment approaches targeting the gut-brain axis? Effective treatment approaches targeting the gut-brain axis include dietary interventions like the Mediterranean diet, probiotic therapy with specific bacterial strains, and lifestyle modifications such as regular exercise and stress management techniques. These interventions aim to improve gut health, reduce inflammation, and positively influence mental health outcomes. Question 5. How is treatment success measured in gut-brain axis interventions? Treatment success in gut-brain axis interventions is measured through a combination of biomarker monitoring and symptom tracking. Biomarkers include neurotransmitter levels, inflammatory cytokines, and short-chain fatty acids. Symptom tracking involves structured questionnaires assessing quality of life and specific mental health indicators. Both objective biomarker data and subjective patient-reported measures are used to provide a comprehensive assessment of treatment efficacy. Thanks for watching our Global RPH production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you. Your support means the world to us. It helps us grow and keep delivering exciting, high-value content. Stay tuned because the best is yet to come.